Hello, everyone, and welcome to the FNC Concussion and Brain Injury Recovery Summit here in 2025. We're going to be talking about some of the different tools that we use here in our office and some of the different factors that can relate to post concussion syndrome and complications after a neurological injury. So, today's topic is going to be about the cervical spine, proprioception, and concussion more specifically. So, really, how does the neck and the eyes and the autonomic system really shape how the brain functions, and how complications in these networks can relate to prolonged symptomatology, or how your recovery timeline can be delayed from different areas of the brain that can become injured and not be rehabbed appropriately. My name is Dr. Ryan Harvey. I'm a chiropractic neurologist, and I'm the lead clinical associate here at the Functional Neurology Center. So, what are some of the key roles of the neck and the eyes and the autonomic system when it comes to concussion recovery and complications with a concussion or a neurological injury? So, some of the things that are really commonly seen with concussion injuries are injuries to the neck. And the reason why that's so important is because there's a really high proprioceptive density in the muscles of the neck, especially the muscles that connect the skull or the head to the spine up in your upper cervical region. So, things like your suboccipital muscles, some of the deep cervical flexor muscles, commonly injured with things like whiplash or any kind of trauma to the head of the neck. The cervical afferents, which are basically parts of the nervous system that signal information from the neck up to higher levels in the brain. They go through the cerebellum, which really is a cross coordination system that really helps fine tune information. Brought about by all these different systems. So things like what's information from the neck and from the eyes and from other areas of my brain involved with my autonomic system, and how can I coordinate all this information to signals, cross-check information to say, are all these systems telling my brain the same thing at the same time, right? We like to kind of look at this from a brain real estate perspective and say, which area of the neuroaxis became injured, and how can we create personalized rehab strategies to help someone in their recovery from, an injury like a concussion. Some of the tools we like to use are different types of strategies involving head, eye, and neck coupling. So things like how can we rehabilitate different reflexes that are primitive in nature, meaning that you don't naturally think, oh, how do my eyes and my neck communicate with each other? These things happen in lower levels in the brain that really aren't under conscious control. So sometimes we have to work on things from a primitive feature and work on networks in the brain that aren't under volitional control, to rehab those areas. Some of those reflexes are things like your COR or your cervico-ocular reflex, or your VOR, which is your vestibulo-ocular reflex. These are really involved with stabilizing gaze, which is like your ability to hold your eyes on targets even while you're moving or while other parts of the world are moving. And then how does your neck and your eyes communicate with each other to do things like head-eye following, or move your head and your eyes together, or head-eye separation, like my ability to move my head through space and to keep the world still, and not feeling like it's floaty or it's rocky or it's shaky, which really gives us mismatching information to our brain, which can create things like dizziness, lightheadedness, nausea, and a variety of different symptoms that are related to things like concussion or head injury. Some of the postural regulation is also really involved with how our eyes and how our vestibular and different systems really communicate with each other, right? And so, are we upright? Do we have camptocormic gait, or do we have abilities to stand upright and fight gravity? Do we have different postural changes in terms of like areas like our shoulders or our hips or our neck, that can create pain patterns, that can create adaptations through other areas of my brain, and meaning that if my neck or my head's tilted, do my eyes have to compensate for that tilt? And does that put more strain on my visual system that maybe relates to things like eye pain or eye fatigue, or just general neurological endurance issues? So, this general concept of sensory mismatch, meaning that are all these different systems signaling similar or the same information to my brain at the same time? And are these areas of my brain involved with my cerebellum and my neural integration, able to cross check information and say, hey, what my eyes are telling me, what my neck is telling me, and what my vestibular or autonomic systems are telling me all match each other, and then everything's gravy. Like we have a good clean signal where everything's telling the brain the same thing. But with concussion and brain injury, sometimes that's not the case. So these types of mismatching information really can drive some persistent concussion symptoms, and really delay recovery in terms of long term, stability and ability to jump back into the things in life that you were doing maybe before your injury. So, what are some of the cervical contributions to these types of injuries? Every concussion has a cervical component, right? So, even if I stood up and I hit the top of my head, you're like, well, I didn't hit my neck, but the compression on the cervical spine can change some of that cervical affrontation. Some of the things we talked about before, like, are the joints of my neck signaling information to my brain appropriately about where my head is in space? Where my head is on my neck, where my neck is related to the rest of my body. And then is that information matching what my eyes are telling my brain and what my vestibular and autonomic systems are telling my brain? And are we having good sensory matching happen, right? So any kind of acceleration and deceleration force stresses the ligaments of the neck, right? So when you think about classic whiplash, you're like, oh, maybe I got hit on the side of my head, and the muscles or the joints of my neck got overly stretched. And what happens is there's mechanoreceptors, and there's different receptors in the fascia. There's just different receptors in the deep muscles versus the extrinsic muscles versus the skin. And all of these different systems signal to the brain, right? And so if we've damaged a ligament or a tendon or a joint or a muscle or fascial tissue or any layer of this musculoskeletal system in the cervical spine or in some of the other areas in the body, then that can really give us poor affrontation or deaffrontate how our brain perceives that tissue. And then we can get a mismessage to the brain and say, hey, well, what my neck is telling me about what my body's doing is different than what my eyes are telling me, is different than what my vestibular system's telling me. And that can create, more longstanding problems when it comes to, symptom recovery, but also, ability to do the things in my life, right? Where my neck might get really stiff, it might get really tight. I might feel like I have a bobblehead. I might get dizzy when I turn my head. All these types of things can happen, after a cervical injury, especially something like a whiplash. So the neck has active sensory organs, right? And a lot of those receptors we talked about before, they really fire into multiple different regions in the brain, right? So things like the cerebellum, like the vestibular system, and the brainstem. Other areas of the cortex involved with somatosensory mapping and knowing where my body is in the world. All of these different areas receive inputs from, in one way or the other, from affrontation from the cervical spine and from other systems. So, disruption in the cervical affrontation or disruption in the information being sent from my neck to higher levels of my brain can really lead to things like dizziness, change in visual function like blurred vision, general imbalance or sensations that I feel like I'm moving when I'm not moving. Very commonly, this can create lots of different presentations of like headaches and autonomic dysfunction, meaning like problems pushing blood around when I'm changing position or when I'm changing task or when I'm doing different activities. These are all different factors related to the cervical contribution to concussion and brain injury. Cerebellar processing. So really your cerebellum is really, really involved with the accuracy and the balance and the coordination of how these different systems communicate with each other, and also cross-check information to say, okay, are all these different systems having good feedback and feed-forward mechanisms of how they're communicating with each other and telling the brain the same information, right? So some really important regions of the cerebellum that we really commonly see affected with this are some midline regions like the nodulus and the uvula. These systems are really, really intimately connected to your brain's perception of gravity through your vestibular system. And they're also very highly involved with your eyes and your neck and your spine, right? So all these systems really have to integrate, how is gravitational force matching with what my neck is feeling in terms of compression of my joints, and using all of those systems to help me understand how do I push blood through my body and to my head, right? Because I push blood very differently when I'm lying down versus when I stand up, right? Because gravity, I'm fighting gravity a lot more when I'm bipedal and I'm standing up against gravity. So what happens is that signals from my brain need to fire down to other areas of my body to help me do things that help increase blood flow to my head, so that I don't drain all my blood out of my head when I stand up, right? And that's a common problem with folks with autonomic, vestibular, cervical, different disaffrontation or sensory mismatch from systems that have become concussed or become injured through a neurological injury. The vermis, highly involved with calibrating some of my different eye movements, like saccades, my fast eye movements. Very intimately connected to how my brain, helps me balance or stand up and fight gravity. And then also very, very involved with my posture. Am I able to stand upright? Do I have postural changes in terms of, how I contort my shoulders and my hips and all of these very midline structures, and things like that, right? The flocculus and the paraflocculus are more fine-tuning calibration systems, especially for the VOR, so that vestibular ocular reflex, which is really how does my inner ear vestibular system communicate with my visual system to make me be able to keep the world and the horizon still, even while my body's moving through space or while my head's moving, or while I'm experiencing motion, right? So if I'm walking down the road, I should be able to look, at the stop sign at the end of the street, and that stop sign should be able to stay still even while my head's moving. So I'm walking, my head's moving. I should be able to keep the world still through this reflex. And if that reflex isn't working appropriately, we're going to see changes in terms of the world may feel like it's shaking when it's not shaking. I might feel like I'm in an old horror film where the camera's shaking while I'm walking. All of these types of things can happen whenever you have poor VOR reflex function. And that could be coming from the neck. It could be coming from the vestibular system. It could be coming from the visual system. Or it could be a cerebellar injury in terms of how am I fine tuning how all this information is signaling to the brain. Faulty cervical input, so again, damage to the cervical joint receptors can give me inaccurate cerebellar calibration. So basically, the joints of the neck fire up into the cerebellum, and if I'm getting poor information about where my neck is in space, that's going to automatically give me poor fine-tuning motions about how my eyes and my vestibular system coordinate what's happening with my neck, and that can create eye and balance dysfunction, in many different patients, right? So a specific rehab strategy is going to really be valuable in terms of improving those functions. The cervical influence on the autonomic nervous system, or the ANS. So like we talked about before, whiplash or irritated joints or muscles can really also irritate some of the autonomic systems. Your cervical ganglia, can become irritated just from irritation to some of the joints or muscles that are anatomically associated with that ganglia. So things like different kinds of stellate ganglion irritation or sympathetic ganglion irritation can cause changes in your autonomic nervous system that can relate to things like, oh, I feel like my hands get sweaty all the time. I feel like, I have a hard time regulating temperature. I'm having tachycardic episodes or tightness in my chest and my heart starts to race. Some of these can come from a structural irritation of these nerves versus a circuitry problem that's after a head injury as well, right? So there's different possibilities, and we really need to do a specific examination to determine what are the different factors that relate to this dysfunction. And is it coming from a structural anomaly or structural irritation, or is it coming from changes in terms of circuitry or matching of information? And determining what is the mechanism of why you're having some of these autonomic symptoms is really important to personalizing rehab to help you recover and get back to normal activity of life, right? So faulty input can also alter your baroreflexive sensitivity. Baroreflexive, basically, these are your pressure receptors. And you have pressure receptors, one of the major ones actually goes through your neck, right? Your carotid sinus is a receptor that's in, the carotid body or blood vessels that help push blood to your head. And what happens is it takes a pressure signal and tells me how much blood pressure am I getting to my head in certain positions, right? And when I see major changes in blood pressure, I should signal back to other parts of my cardiovascular system to compensate for that, right? So either change blood flow diameter, like how much blood I'm pushing around, change my heart rate, change my blood pressure. These things are, really directly involved with how my brain is sensing perception of pressure going through these blood vessels. So this can really create blood pressure instability, and this can happen with a whiplash, where you have changes in terms of that pressure receptors in your neck, called baroreceptors, and the sensitivity of how well can I determine, what's happening with blood flow. Cervical dysfunction also can worsen other, pre-existing conditions or other complications from a head injury or a concussion. So things like POTS, or postural orthostatic tachycardia syndromes, orthostatic intolerances, meaning that when I stand up or I change position, I have problems, or just general dysautonomias, which could be a variety of different symptoms related to, blood flow, cold hands, cold feet, sweating, feeling anxious, feeling nauseous, having trouble with any automatic function, the things you don't really think about. This can even be related to your sleep. So these are all automatic systems that you don't have volitional control over. Treating the neck can improve pain, but it can also change some of the neurological function related to your fatigue, related to dizziness, and related to that inability to change, how you push blood around your body. Um, So, what are some other structural factors that relate to this? Whiplash, really commonly affects some of these upper cervical ligaments involved with the areas of my neck that connect to my skull, right? And so, your upper cervical spine has ligamentous tissue that attaches my skull to those vertebrae, like C1 and C2. And a lot of those ligaments, like the alar ligament, the apical ligament, transverse ligaments, they can create instability, right? And you can develop what's called craniocervical instability after something like a whiplash. So if that's not something you've had assessed, that's something that's really, really important to getting good long-term stability in terms of symptomatology. And sometimes it creates major issues in terms of structural pain with your neck, but also it can complicate other areas of the neuroaxis, just from having damage to ligaments of the neck as well. So CCI is that craniocervical instability and laxicity at that C0, which is your occiput of your skull, all the way down through your C2, can create problems with things like, oh, I'm experiencing headaches, I'm having, general structural compression of different tissue, or I have that general sensation that my neck's not very stable, right? A lot of times you're going to have compensatory muscle guarding, meaning that muscles are going to get very tight to protect the neck after a ligament or a tendon injury from something like a whiplash. This can also create issues with general chronic pain, right? Where I don't see major benefit from different therapies in terms of working on my neck, but also I have general neurological endurance issues where the more I use my neck, the more my brain, my brain symptoms become more intense. That's something that we want to be able to assess and treat more appropriately. So some of the symptoms related to CCI could be things like, oh, I'm having visual hypersensitivity. I'm having problems with getting overstimulated by my vision because I'm not getting as much good afferentation from my cervical spine. I could have tinnitus, so I could have ringing of the ears or changes in terms of, having hearing pitches that maybe aren't actually there. Or just general worsening of symptoms whenever I'm weight bearing, meaning that, oh, I feel great lying down, my neck's not really being compressed by gravity. I stand up or I sit up and I'm fighting gravity and all my symptoms become more intense. The cervicosensory-motor dysfunction, also relates to some of the testing we can do to assess how the neck's functioning. So things like joint position error. Do you know where your neck is without your eyes? So that's a really important test that we can run through. Are you having oculomotor disturbances? So can we check things like your tracking abilities, your ability to shoot your eyes to targets, hold your eyes on targets, and does that change with the function of when we use your neck in different positions, or we use your neck in different tasks, does that change how your eye movements work, right? Are you having changes in balance, right? So what's your general balance look like? Does it change whenever you close your eyes or open your eyes, or does it change when your head's in different positions? Or does it change whenever you're being stimulated in different ways? And then sensory-motor dysfunction also really can relate to pain and then pain resolution, right? So if we can work on these things, this can really reduce pain long term. Some of the assessments we do are things like the ability to do 3D tracking of head position. So how is your ability to know what's your range of motion, what's your joint position error look like, what's your head-eye following abilities look like. Assessing all these and getting good analytics can tell us what's normal, what's not normal. We can also get real-time feedback, and be able to do things like use this type of software, use the different kinds of technologies to help accelerate rehabilitation programs for the cervical spine as well. So this does things like helps us retrain our accuracy of our cerebellar maps and our cerebellar coordination. And we can use this with a combination of visual vestibular rehab to really calibrate how these different systems are communicating with each other and telling the brain the same thing at the same time. Some of the different components we look at with these kinds of injuries are things like, a chiropractic evaluation. So what is the general movement of the spine? Do you have tender knots? Do you have joint dysfunction? Are you having instability? Are you lax? Is your neck lax? Have high laxicity? What's your posture look like, right? So we're going to palpate and assess the neck from a structural standpoint, but then we're also going to get more advanced diagnostics on, how is your neck functioning from a range of motion standpoint, from an ability to find neutral or have a joint position error, and then your ability to be able to follow targets with your head and your eyes together, which is very, very valuable information as well. We're also going to look at like a full visual examination, assess all of your different eye movements associated with parts of your brain, but also with neck coordination. We'll do balance testing. We'll do autonomic testing. We're going to just try to assess all the different real estate in the brain and see which areas of the brain are dysfunctional and what's functioning appropriately, and then try to have a more personalized approach to how we can recover an injury like this, especially a complex concussion. An integrated program or a multimodal approach is really, really valuable when it comes into improving long-term stability with these types of syndromes. A combination of different kinds of manual or chiropractic therapies, myofascial release therapies, different adjustments, whether that be manual or less intense. Proprioceptive retraining, so using things like head-eye following tools, getting motion-based feedback, using advanced technology to help accelerate your recovery, different types of head, eye, neck integration strategies involving some of those reflexes we talked about, like your COR, your VOR, your head, eye following, your head, eye separation abilities. Using different kinds of strategies involving your cerebellum or your vestibular system, things like optokinetics, or using balance training, or using different types of coordination-based tasking to help, rewire these systems together. And then really just making sure that you're able to adequately push blood around relative to different situations, right? Whenever you're changing position, whenever you're changing task, and working through different things related to that ability to change blood flow, as well as look at what's happening with your neck, with your eyes, with your vestibular system, and all the other factors here. So those exam components, like we talked about before, are really related to assessing the entire nervous system and getting an idea of what's functioning well and what's not functioning well, and personalizing treatment rather than just throwing darts at the wall and hoping that something gets better. So these are all things that we kind of spoke about. These are really, really important tools to long-term recovery. Here's a case. We had a 36-year-old nurse, post motor vehicle accident. She was having symptoms of headaches and dizziness and blurred vision. She had been to see multiple providers. Had months of symptoms before getting real improvements. She had changes to her cervical spine, especially that upper cervical area. She was having major problems with joint position sense, or knowing where her neck was without her vision. Having changes to her cervical ocular reflexes and her VOR, and then just having general tachycardic episodes, so like changes in like racing of the heart and things like that. We did use a multimodal approach with her, so using things like manual adjusting, doing neck care assessments and neck care treatments, working on her reflexes, both with her COR and her VOR, visual motion, different rehab strategies, and then working on her ability to push blood to her head in different positions. She had major changes in terms of that joint position error, or her ability to find neutral with her neck, major normalization of things like her VOR and her COR, and then resolution of things like dizziness and the ability to be able to return back to like a lot of her activities. So the big picture here is the clinical impact of how your cervical spine, your vision, your vestibular system, your proprioception all integrate together, and understanding that these are all different factors that can be really important in terms of retraining and regaining control of these different parts of your life and of your function, and get you back to doing things in your life, rather than just doing brain rehab forever, right? And just kind of hitting, just keep hitting the same stuff. So these are all some different resources about some of the things we talked about today. I hope this was valuable, and excited to continue to kind of go through this summit and give you more information about what are the different factors that can relate to some of your symptoms, and how are we able to provide more tools for resolution and long-term stability. I appreciate it. Thank you guys. Looking forward to the rest of the summit here.